That is what I'm most worried about. Just knowing how bad it can be if they get really ill.
Shayla Bradley is a Kingston mother of two whose 9-year-old daughter and 5-year-old son are currently at home sick with the flu.
They've just been, out and not feeling well for my son for over a week now. That's kind of more prolonged than anything that they've had to deal with before,
including COVID-19. This is her son's first case of the flu. The last 2 years of pandemic prevention measures like masks and virtual learning means a large number of children haven't been exposed to common viruses like the flu and respiratory syncytial virus or RSV. It's made them more vulnerable to catching them, and many of them are getting quite sick.
We are seeing lots of kids being hospitalized with RSV and influenza, no doubt.
Pediatric infectious diseases physician Dr. Kirk Lifeso says influenza and RSV can be hard to tell apart, especially in children 1 or 2 years of age.
Influenza compared to RSV tends to present with higher fevers, maybe less symptoms in the nose, like less runny nose. And then in kids who get a little bit older, tends to then present with the body aches and pains and dry cough, sore throat, and fatigue. Whereas RSV in older children tends to just stay in the upper respiratory tract and doesn't seem to cause the same, or isn't usually associated with the high fevers.
The first line of defense against influenza is getting vaccinated, but there's no vaccine to protect against RSV. And while the cases of influenza are not necessarily more severe than prior to the pandemic, more children are getting sick at the same time, putting a strain on hospitals.
I would say the other thing that we're concerned about as physicians, I think, is just our capacity to take care of these children. So while we're seeing higher volumes, those volumes are coming up against a system that has been stressed and that lacks capacity.
To keep kids out of hospital, Dr. Lifeso says everyone 6 months and older should get their flu shot. If a child catches RSV, parents need to monitor their symptoms and make sure they drink plenty of fluids, but if they start struggling to breathe, take them to hospital. Strickland, Global News, Kingston.